2 years ago, Americans watched in horror as a crisis unfolded at the Kabul airport.
She was tear-gassed and beaten.
Images of thousands desperate to escape Taliban oppression filled our news feeds. More than 80,000 Afghans made it to America. But the story didn't end there.
It was very cold. There was no power, no heat.
Who would help our newest neighbors? I'm Andrea Smartin. In Stranger Becomes Neighbor, you'll hear the stories of some remarkable refugees who left their homes and their dreams behind, only to start over from zero.
Their only possession was 3 blankets.
And you'll meet Americans who stepped up to help them.
You want me to come when you deliver your baby.
What can one person do in the face of an international disaster decades in the making? That's Stranger Becomes Neighbor. Find us at kslpodcast.com. Follow us on Apple Podcasts or anywhere else you listen.
Hey, welcome to Project Recovery, a podcast about addiction. But more importantly, it's about what, Dr. Matt?
Recovery.
That's right. We celebrate all things recovery. And today, we've got a great show for you. But before we get to that...
I'm glad I was paying attention. I was starting to drift off there for a second.
When a doctor drifts off, where do you go? Because I know there's at times that you're doing therapy and you don't want to admit it, but somebody's saying some stuff and your mind wanders and drifts. What does a doctor think about?
Laser focused.
That's not true.
100%.
That's why you guys take notes, so you can go back and say, oh, this is what you said.
Sometimes I'm thinking about dinner.
Dinner?
Yeah. But mostly laser focused.
Laser focused.
With a little dinner on the side.
Okay, before we get to our guest, what do you think?
About?
You know.
Nope. Oh, no. You have pants on? Oh, shoes?
These are the Lululemon pants.
No, these are the Lululemon
pants.
I'm disappointed.
Go ahead, touch them.
Well, they are kind of stretchy.
Yeah.
But they've got pockets and stuff. I thought they'd be sexier.
What do you mean
Yeah.
That was weird.
Turn around. Well, I don't mind saying sometimes, a guy can
you want me to do the full turn?
Yeah. All right, I kind of like those. Are they comfy? They feel comfy?
Yeah, I mean, look at this.
Yeah, look, you can do all sorts of things.
Remember, these are the ABC pants.
What was that stand for?
Anti-ball crushing.
Oh, that's right.
Yeah. No, but that's what it says on the label. I'm not making this up. This is not a joke.
Really?
That's what they are.
Okay.
Sat down, no problem.
Do you think I could afford a pair of ABC pants?
Do you want to play a game?
I might want to get a pair. Those are
How much do you think they cost?
Now,
mind you, I didn't buy them. My girlfriend bought them for me for Christmas.
Okay, so they're a Christmas present. $85.
Higher.
$125.
Higher.
$200.
Lower.
$175.
$139.
Not worth it.
How do you know?
Because no pair of pants is worth $140.
I used to think that. But right now, I can go from the gym to work to the club and not have to change pants.
I do all that in the pants I'm wearing right now.
No, you're not going to the gym in those pants. You shouldn't be going to the gym in those pants.
I'll wear my khakis to the gym.
I tell you what, if you go to the gym in those pants, you're the creeper and they're getting you kicked out. Because you're matching it with that lobster shirt.
I'm wearing the lobster shirt today. I felt like it was a lobster day.
Yeah, I think so.
$140. Maybe I'll have to put that in for Christmas next year because I'm not spending that money.
I'm telling you, normally I wouldn't.
I'm not a fashionista. You know that.
I'm not fashion forward either.
Yeah.
But there is something about that Lululemon. They've got something figured out.
I just can't even say Lululemon like I'm wearing Lululemon. I would feel awkward.
I just found out 3 months ago Lululemon made guys stuff.
I didn't even know it until you told me.
Now I got a pair of shorts.
Yeah.
A pair of pants.
Yeah.
And a ball cap.
Why do you need a ball cap from Lululemon? Was that a freebie? Did they throw that in?
No, you would think that with as much as that cost. No.
Yeah, they didn't throw that in?
But that wasn't too much. It was a $30 cap.
Does it say Lululemon on it?
Doesn't say anything on it.
Okay.
It's just a black trucker hat.
I can get you one of those for like $8. Go to the Maverick.
This one's a Lululemon.
All right. Okay. Well, you know what? You are always dressed well. You look nice. I think you outdress me every time. Well, except for Lobster Shirt Day, which I have on today.
But that's all due to Leslie.
Well, kudos, Leslie. You're doing well. She's doing great.
Yeah.
I'm
a lucky man.
I want to see some high kicks before we leave today.
Okay. Well, let me just do one for you.
One high kick.
Remember, I got a fake hip.
That's true. You do. Ooh. That was actually pretty high for a fake hip.
That was the fake hip, too.
That was, huh? All right. Well, ABC, I'm a believer. I'm just not spending that much money on pants.
You know what? I tell you what. You hit the gym, you drop a few LBs, I'll let you borrow the pants.
All right. I'm not sure I want to wear your pants. But that's a whole nother episode maybe for different kinds of addictions and problems.
We'll talk about that later.
All right.
But we've got a fabulous show for you today. We've got Christen in, and Christen reached out to me on Facebook. And Christen, you wanted to reach out to me. Why?
Well, because I don't think a lot of people understand addiction and the tie-in with medications such as ADHD medications, things like that. And there's a lot of things I wish I would have known 10 years ago that I know now.
Now, we're not talking about your addiction. This was your son's addiction.
Right, correct.
And what was his DOC? And when we say DOC, that's the drug of choice. Mm-hmm. So what was his DOC?
Adderall.
And we've got your son here, Spence, and we're going to talk to him in just a second, but we want to get your kind of take on it before we bring him in. So at what age did Spence get prescribed the ADHD medicine?
Gosh, I was thinking about that this morning. I want to say it was, I think it was around 14, 15.
And what is the Adderall designed to do, Dr. Matt?
Adderall's in the class of stimulant medications. It's an amphetamine-based medication that the intention is that it helps the brain, specifically the frontal lobes, focus. And so a lot of people who have ADHD have a hard time establishing and sustaining focus and attention on things, and that may be accompanied by hyperactivity as well. So when we say ADHD, it's attention deficit hyperactivity disorder. Some people have hyperactivity, some don't. And in the olden days, when you and I were growing up, they often thought that people with attention problems also had low IQs or learning disabilities because they didn't perform very well in school. And what we have found with proper treatment, and often medication is part of that, people's IQs and abilities to learn kind of come up to the forefront, and their grades improve and their learning improves when we correct their inability to sustain attention or establish and sustain attention. Now, so it stimulates the brain. I use the word amphetamine, so we do know that it's an abusable drug and it's a very controlled drug, but probably, how old is your son now?
26.
So, 12, 14 years ago or so, we didn't have quite the same level of prescription control on those medications that we do now, and
probably not the same knowledge.
Right, and in higher doses, it's very abusable. So, it is a helpful medication when it's properly used, but it certainly can be a medication that creates addiction and is abusable. When
we had Rob Eastman in on the podcast, he talked about him being prescribed a drug that was similar when he was younger, but it was called Ritalin. Is that in the same family?
Yeah, Ritalin was the first generation of those sorts of stimulant medications. And back in his day, kids usually had to take it 2 or 3 times a day because of how it was created chemically. Now we have extended release medications that are in that class where a kid can take 1 capsule in the morning and it lasts till the late afternoon.
We also had Dustin Hawkins in, who said he remembers popping one of those, and all of a sudden his walk to school was fun.
And so there's a few problems there. I mean, one is that just like any DOC, sometimes a particular substance is just your jam, it just clicks with your individual biology. For a lot of people who take Adderall or similar medicines, they're kind of like, it doesn't really do a whole lot for them.
They could love it or leave it.
Yeah. And then there's the misprescription, like the inaccurate diagnosis. So some kids, inattention, I'll throw this out there because this is important for people to hear. If somebody said, hey, my child or I am really struggling with sustaining my attention, being focused, then what's the average person diagnostically is going to jump to the idea that, they must have ADHD. Well, problem is, problems with attention are symptoms of almost every problem that we have.
So you think anxiety, it's misdiagnosed?
Learning disabilities, depression, problems at home, abuse, all of these things that could be affecting kids they're likely to struggle with their attention when those things are happening. Is it misdiagnosed? Absolutely. Is it? But lately, in the last decade, we've really increased in our ability to diagnose it more accurately. So the misdiagnoses are way down because mental health people are more involved now. In the past, it used to be a parent and a teacher would talk. They would say, oh, my gosh, Junior's really all over the place. He can't settle down. He really isn't paying attention. I think, they'd discuss it. Mom would go talk to the pediatrician. Pediatrician would say, oh, sounds like ADHD. Wham, there you go. And we prescribe this fairly serious medication for the kid when, in fact, he just may be, having a zillion other things, like I mentioned before, going on that are causing that, or the prescription may be too high. So walk into school and feeling all kind of fuzzy and airy in your head sounds to me like too much Adderall. Does that make sense?
Yeah.
So it's something that you need to really be working with an expert on. If you're a parent who has a child who takes this medication, or if you're considering taking it as an adult, I do recommend that if your general practitioner is prescribing, you talk with them and make sure that they feel very comfortable in managing that medicine for you or your child. My main recommendation would be try to work with a psychiatrist because they should be having that. So it's a serious medicine. It is one of those that is abusable, but is also very helpful to a lot of people. I can share. Can I share on the show a little bit? Okay.
Yeah.
So I have a son who's an amazing guy who has Tourette's, the tic disorder. And along with Tourette's, the Tourette's triad is anxiety, specifically obsessive anxiety, ADHD, and Tourette's. And luckily his Tourette's is fairly mild, but his ADHD, it was pretty intense growing up. And he was way behind in some of his academic classes in elementary school. And when we finally took that extra step and put him on a medication in addition to the behavioral things that we were doing to help him with his Tourette's and his attention, that was kind of the missing piece. And he caught right up on his reading levels and his math levels. And that's been, and he ended up graduating from high school with a higher GPA than I ever had.
Wow.
And so we've benefited in our family from that particular medicine. At the same time, as a clinician myself, I
the dangers and the perils.
Yeah, I work with people all the time who, from a good intention, might end up with a problem because of a misdiagnosis, or perhaps an overprescription, or just a tendency to abuse the medication. And then there's that DOC factor, right?
Yeah.
For some people, it's just boom.
You're listening to Project Recovery. We're talking with Christen and her son Spencer about his Adderall addiction. We'll be back in just a few seconds.
Two friends taking pictures of the rising full moon on a summer night.
Two teenage kids doing what teenage kids do.
When a stranger with a gun and a death wish changed everything.
It was violent, it was senseless, and I will never understand it, I will never accept it.
I'm Amy Donaldson, and unfortunately, we're all too familiar with stories about how violence shatters lives. But what we rarely see is how they are rebuilt. In a new podcast, The Letter, we relive tragedy, but only so we can hear the rest of the story. The struggle to reclaim lives, the realities of grief, and the possibilities of forgiveness.
I believe in miracles. Sometimes I thought, there are no miracles. Yeah, there are, and this is a big one.
Follow The Letter at theletterpodcast.com or wherever you get your podcasts.
Well, let's get back to Christen. Do you think Spence was misdiagnosed, or was...
No, absolutely not. When he was a kid, he's crazy smart, very, very smart. And when in the earlier grades in school, he would get in trouble, and the teachers would say, "Well, that's how gifted kids are. It's normal." That's when they used the whole gifted kid.
Mm-hmm. He's just smarter than everybody else. He's done his
he's
work.
Bored.
Yeah, he's bored.
And as he got older, I started to kind of see that it wasn't just that. And I kind of at first I attributed it to everyone kind of giving him a pass. Mm-hmm. Teachers and stuff. Oh, he's gifted. It's okay. And then I'm like, it doesn't matter how gifted you are if you don't have any social skills. Like, that's a big deal to me. So, and I never wanted to medicate him. I was very leery of medication. Knowing what I know now, I feel a little differently. But his dad was terminally ill, and when he got to the point where he was like on hospice and things were getting real tough, I wasn't dealing very well with 3 sons and a dying husband. And Spencer, and I think children with ADHD they want a lot of attention. It takes a lot of you. And I didn't have the time to give him. So that's when I reconsidered medicating him, which in retrospect, that was probably the worst time I could have done that.
So this is when he was about 14.
Mm-hmm.
And you put him on Adderall then?
Mm-hmm.
And what did you see out of his attitude and out of his social graces and stuff like that with the Adderall?
He could sit still. He was better at making friends. You know, he had a hard time with the kids when he was younger because he never wanted to do the things they wanted to do because he thought it was dumb. Like, that's dumb. Why would I want to do that? You know? And I think he started to gain, you know, he got more involved in social things. He was able to do homework and get, you know, to where before I couldn't get him to sit down long enough to do anything. And with everything I was going through at the time, that was wonderful because I didn't have time to sit down with him and do homework and stuff like that. And he was able to do those things on his own. And he would bounce around a room constantly. And
but sometimes people just chalk that up to boys being boys or kids being kids.
And that's where it is helpful to consult an expert because there are ways of knowing the difference between, is this with what the term is called within normal limits, right? Nobody is exactly like anybody else, but there are ranges of behavior that we'd say are pretty typical for kids at certain ages, and we want to be able to judge, is this kid's squirreliness within normal limits? Is it normal kid squirrely behavior? Or is it outside of those? And if it is outside of those, how much of a problem is it causing in their life? Kids who struggle with not being able to sit still in class not only struggle with their grades, but like you mentioned as a mom, you were noticing social skill deficits. Kids who are ADHD kids are personal space violators, you know, and other little kids aren't very forgiving of that.
Yeah, it's like,
right?
Hey,
they'll push them, they'll punch them, they'll say, "Get out of my face," and then it hurts that kid's feelings because they don't realize they're being too much for the other kids, and they go home feeling rejected, and self-esteem takes a hit, and those sorts of things are all important to consider. It's not just the academics, but I'm glad you brought up the social and interpersonal factors. Kids who I've spoken to have grown up into adulthood, that's actually more of a lasting impression negatively on them than their grades.
Yeah.
So he's taking the Adderall. Things seem to be getting a little bit better.
Mm-hmm. Yeah.
And how long did that continue for?
You know, it was a couple years. And then his dad passed away when he was 16. And I thought he was okay at that time, but I don't think he was. Were you abusing then? Yeah. And it took me a while to figure out what was going on because I had 2 other kids. A
death? I mean, yeah. I mean, your plate was full.
Yeah. But that's no excuse for not paying attention to what's going on.
No, but I mean, it's life.
Sure,
there are reasons why things happen. I like to draw a distinction between a reason and an excuse.
Yeah.
And as we look back, especially as parents, we often can see where we wish we had done things differently, but I think that's universal.
Yeah.
Well, let's have Spence step up to the mic real quick and talk about that. You can use that mic right there. Do you remember when you were 14 and all of a sudden you were put on Adderall?
Absolutely. Clear as day. I can remember the exact day that it actually started to take effect for me. I was sitting in English class, and in the 9th grade, I didn't have a lot of friends. I'm the crazy guy, you know. I'm the class clown, but class clown doesn't really have a lot of friends. I mean, he's funny in the moment.
Yeah.
And I could actually sit down, and I could listen to the teacher talk, and my face would be in my book instead of looking around to try and find somebody to talk to. And it felt good. It felt very, very good. Without a doubt, I have ADHD, and it helps a lot when I take that. But there goes from the kid that's taking it every day like he's supposed to. Then there's the person who's abusing it every day. Once you cross the line, you can't go back. You can't. And it was just, I wish sometimes so bad I could get back to where it was just taking the meds like I was supposed to.
You know what? But that's common with a lot of addictions. Yeah. There's so many times when I was battling alcohol that I go, I wish I could go back and just drink like a gentleman. I wish I could go back and just sit down and have 2 beers. I think I told it on this podcast the one time we went to San Diego with my girlfriend and we went to a Padres game and everybody's up there eating peanuts and beer. And I thought to myself, this should be a time that I could be able to have a beer. These are what beers are made for,
right.
Is sitting down at a baseball game, having some peanuts and enjoying it. Yeah. But the reality is I know that's not going to happen for me because I'd have 3 beers before that beer and I'd have 4 beers after. I was never just a 1 beer kind of guy. I couldn't stop at 1 beer.
Yeah, and I think anybody who's battling or has battled an addiction, they know that they're powerless to that. You know, in your head, you think, I wish I could go back and use that prescription as it was intended. Absolutely. Or I wish I could just enjoy a beer while I watch the baseball game with my buddies. But you know that once you start down that path, it takes over.
Somebody once told me that a good example is you've got a cucumber. And once you turn that cucumber into a pickle, the pickle never go back to a cucumber. There's no going back. You can't go back. And so that's what you're saying, Spence, is that
absolutely
you started to abuse it.
Yep. And when you start to abuse things, you can't trust yourself with it anymore. I've tried the whole go back on it like you're supposed to.
I'm going to do it just like the label says.
Yep. And then the inner addict in me kicks in. How am I going to find it? Who has it? Is it my mom? Is it my wife? Is it my grandma? Who has the pills? Okay. So I figure out who has the pills. Because sometimes if they were trying to help me, they would keep it from me and I wouldn't know who had them. Then I'd find out who had them. Then I'd find out where they were and how I was going to get to it. And that would start going through my mind while I was just trying to take it like I was supposed to in the first place. Because it helped me. It made me productive. And
you wanted to be more productive.
Absolutely. Even in nowadays time, everything's go, go, go. Everything's fast-paced. Can you put out more numbers? And that's just generalized. That's just not specific to anything, really. Everything is just kind of more fast-paced nowadays.
We live in a microwave society. I want it now, I want it hot, and I want it fast.
Absolutely. And that helped me get there a lot because I'd be pushing out, more homework was getting done. My tests were getting done. I was getting things cleaned. I was doing things like I was supposed to. And that's the hard part about it.
Yeah, let me ask you, a lot of people who have a similar experience that you're describing, beyond just the fact that you're more productive, you're finally getting the positive reinforcement from your parents and your teachers that you'd always wanted, right?
Yes.
Because
that is a huge thing to hit on. It's huge because you're making people proud.
Yeah, and and a lot of kids with ADHD, perfect, yeah. You aggravate the heck out of everybody. You get tons of negative feedback from teachers and parents, and they're aggravated with you. And as a kid, that feels bad because my experience is most kids with ADHD are like any other kid. They just want to be liked and loved, and they don't want to get this negative feedback. And when you take the medicine that helps you kind of focus in, get your chores done, and mom comes home and says, oh my gosh, the living room looks great, or the teacher says, wow, you're all caught up on your work. Good job. Those are things that a kid with ADHD hasn't ever heard before.
They start to use you as an example. So you're prescribed it at 14. At what age did you think you started abusing it?
So I can remember why I started abusing it and that would put me when. So Dad died when I was 16. That was 10th grade. In about the beginning of my senior year is when I started to abuse it because I realized I could stay up all night and play Call of Duty with my friends if I just took another one. And at the same time, I was battling with it running out too early. So I'd be fine. I'd feel normal. I'd feel like I fit in until about 1, and then I'd need to take another one because I'd start to get squirrely again. And I hated that part about myself. I hated the ADHD part about myself because that was the part of me we were trying to get rid of. Right, with the medication.
And these pills did that.
Yeah. So I'd take another one. And then nighttime would roll around. I'd be like, all right, well, I want to stay up and play games with my friends. I'd take another one. And I'd be up for a day. And I'd crash for 2. So it started happening in high school in little micro doses. That's when it started happening. So
And if I can make a plug for, since we are talking so much about the disorder of ADHD, if you look at the research on treatment for ADHD, we do know that for the vast majority of people who truly meet that diagnosis, a medication is very helpful. However, for long-term change and progress, when the biological symptoms are being addressed with the medication, that's the time where behavioral training really needs to take place. Yeah. And that's one of the things that I think the medical profession, mental health professionals, teachers, and parents, we don't do a good enough job seeing that as an important part of the treatment, because you get such an immediate effect from the medication. You think, oh, problem solved. Yeah. But like you're saying, you as a person, an individual, you can feel it wear off, and you're not left with any real behavior change. You're not retraining. You can retrain your brain by retraining your behaviors and your patterns of thinking. So social skill training is very, very important for kids when they're on a medication that's taking care of the biological symptoms. Study skills are very, very important. Time management skills, all these sorts of things can be trained that for most people kind of naturally evolve. But if you're struggling with ADHD, you haven't naturally developed those skills. So if you're a parent listening and your child's on ADHD medication, that's great if it's working. But I really encourage people to go beyond that and work with a behavior specialist, a psychologist, or a therapist that has training in this, so that, and a lot of times the school counselors are very good at helping with social skills training, study skills, things like that. So I'm glad you brought that up, because that's one of the biggest dilemmas and one of the biggest gripes I have, because I'm not a prescribing physician, I'm a psychologist, and I'm the one talking to kids who say exactly what you just said, which is like, it wears off and I just want to keep having fun with my friends. I don't want to go back to feeling rejected or off task or getting behind in my schoolwork. So the temptation to keep taking that medication now inappropriately is definitely there for a lot of people.
That's where I noticed it started to become an addiction, honestly, is because I was taking something to fix something. But it wasn't like a normal... I was taking it to fix myself, and I think that's a big... When people take things to fix themselves or do things to try and fix themselves to the extent I was doing it, it's an addiction.
You've just heard part one of Christen and Spencer on Project Recovery talking about Spencer's addiction to Adderall. Click on over to part two of Project Recovery.
The contents of this program are for informational purposes only. The program is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed therapist, or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you've heard on this program. KSL does not recommend or endorse any specific tests, physicians, products, procedures, opinions, or other information that may be mentioned on the program. Reliance on any information provided on the program is solely at your own risk.